Capenergy launches the first vascular Tecartherapy equipment with a medical CE certificate for the treatment of diabetic foot, ulcers, venocirculatory pathologies, and peripheral neuropathies. The great importance of this invention is the fact that it is the first certified device bridging the gap between conservative surgery, where lower limbs with poor blood flow are amputated, and palliative nursing cures. Until now, there was no clear technological solution that offered an effective therapeutic response to pathologies such as deficiency or absence of blood circulation in the lower limbs, pressure or pressure sores, pain or paresthesia, and disorders derived from peripheral nerve dysfunction. Thanks to this innovative option, the patient has a scientifically endorsed treatment element certified by the health authorities to effectively treat their pathologies. Let's see how it's done. In the first place, it is important to note that this device uses a very specific therapeutic target that has proven to be the most effective at the moment. This is the restitution of the altered circulation. Glucose, in the case of diabetes, as well as other disorders, modify the body's ability to facilitate the arrival of arterial and venous flow to the most distant members of the heart. So, this fact can cause deficiencies in the amount of oxygen and nutrients provided by the blood, as well as an incorrect defense of the immune system against bacteria and external pathogens. This can cause skin infections and ulcers that put the limb at risk. If the circulation to the leg or foot can be returned efficiently, the underlying problem is corrected: blood, vascular, arterial and venous, and lymphatic circulation. So, 90% of the problem is solved. This procedure of fluid drive is due to a physical law called hydromagnetodynamics. This law establishes that all fluids move faster when they are subjected to an electromagnetic field, just as we do with the application of Capenergy technology. Second, the device also performs an effect at the skin level. In this case, the established therapeutic target is the hydration of the damaged skin, and the creation of type 1 collagen to stimulate the correct healing of the ulcerated tissue. This is possible thanks to the powerful regenerative effect of the radiofrequency and thanks to its ability to produce collagen when the correct temperature is reached. These two therapeutic targets combined make the result of the treatment of diabetic foot, ulcers, and peripheral neuropathies a success. Now, Capenergy has combined these two therapeutic targets into a single device on the market that allows maximum therapeutic intensity and efficacy to be achieved. This is how the C100 Vascular Tecartherapy equipment was born, with its innovative C-boot device, an orthosis that adapts perfectly to the shape of the foot and automates the treatment. The C100 vascular equipment is a certified medical device that is indicated for the treatment of vascular lymphatic dysfunctions, ulcers and peripheral neuropathies of the diabetic patient. The C100 vascular equipment is a certified medical device that is indicated for the treatment of vascular lymphatic dysfunctions, ulcers and peripheral neuropathies of the diabetic patient. Although this symptomatology is common for the diabetic patient, it is not just theirs, and there are many other patients who suffer from them. This device has an innovative orthosis, the C-boot, which houses the affected foot or leg and activates the circulation intensely from within. C-boot. This accessory is unique because it is designed in the image and likeness of a leg, and this allows it to be the natural accommodation of the limb to proceed with its treatment. Thanks to the fact that this orthosis incorporates the emitting and receiving current accessories as standard, the professional can automate the procedure by placing the patient's foot inside this container. First, the professional applies a hygienic coating as a bag on the patient's foot that guarantees both his hygiene and that of the accessory. The C-boot device has a temperature control mechanism by means of a sensor that avoids any type of discomfort and fully guarantees patient safety, making the therapy pleasant at all times. This characteristic is very important because not only quality therapeutic results are achieved, but it also allows treatment in totally safe conditions for the patient. No risks of discomfort or burns. The rate of effectiveness in the treatment of pain is extraordinarily high. Already from the first session, 90% of the treated patients affirm that they observe a circulatory improvement and that the pain is reduced by 75%. As the studies carried out by recognized hospitals and researchers reveal, the results leave no doubt that there is a before and after in the technology with the invention of this device. The results obtained with the C100 vascular equipment have proven to be 85% more effective than the usual treatment techniques available today. If we compare it with nursing cures, there is a saving of more than €6,500 per year per patient in stage 4, and 100% of the patients treated closed their ulcers at most at 8 weeks of treatment. This technology finally offers quality results in short times. In addition to the quality of care, the Vascular C100 stands out for being painless, having no negative side effects, and for being an operational and profitable working instrument for the professional.